All right, well, time for our weekly coronavirus check. This is when we talk to a top doc at AHN, Dr. Arvind Venkat, to get information. We really need answers that you all want to know about where we stand right now in this COVID-19 crisis.
And a lot of new information surfaced over the weekend, and Dr. Venkat joins us to help sort this all out. And so, Dr. Venkat, we wanted to ask you first. Governor Wolf and the health department said that on Friday, if we leave the house, we should wear a mask. This is different advice than we heard before. So why the change?
So good morning and pleasure to be here. The change in advice is coming about because we're getting more evidence that beyond avoiding close contact, there may be some spread of the virus from particles in the air, not to a great extent, but to some extent. And so what that means is that we need to protect others by putting a face mask when we leave the house.
Okay. And so, and doctor, we should say we're hearing your voice rather than seeing you because we're having a bit of a technical issue with your picture, but we thank you for joining us nonetheless. So the masks are really more about if you unknowingly have symptoms, you're preventing the spread of this from you, right? It's more about that than protecting you from the virus that could be out there. Is that correct?
That's correct. You're not really protecting yourself from getting the virus because cloth masks don't have that degree of filtration, but you're protecting others. And you're also potentially giving yourself a precaution against touching your face. If you have a mask on your face, you're probably more reluctant to touch your face.
Makes sense.
And so a lot of people are wondering about this. Do kids need to wear masks?
So the recommendation is that anybody leaving the house, especially if they're going to a place like a grocery store where there may be a bunch of people there, that they should wear a mask. The one caution I would have about wearing masks is that it shouldn't be used as a substitute for social distancing.
Right.
So again, the most important recommendation is to minimize trips outside the house, and that includes kids.
Doctor, health leaders are saying that this week could perhaps be the worst week that we've seen so far. Do you think that that is true? And does it really apply to our area? Like, are we even close to hitting the peak of this in our area?
So a lot of this evidence is coming from public health experts who model the course of disease. And the reason that they believe that this week may be the worst week is that a lot of the efforts to really socially distance only started about anywhere from 2 to 2.5 weeks ago. And so based on the course of disease, we expect to see, unfortunately, the most severely ill patients and the highest number of patients this week. But that could rapidly change. And all the modeling is based on the idea that we continue to socially distance. And so we really need to continue to practice that to get over this dreadful peak that we're likely to see.
It's really sad to think about. But as we're talking about this, if someone in your house does become sick or appears to have symptoms of this, what should you do? If it's somebody else in your house, should you then consider yourself quarantined and isolate yourself? What if you need to go out to the store?
So the person who is sick needs to self-isolate within the house. So they need to be in their own room with their own bathroom as much as possible. For those who are within the house, the Department of Health guidance is that they are on quarantine and they really should not leave the house either. And so if you have to leave your house for groceries, I think you have to look at options like delivery by friends or by delivery by the grocery store that they can put outside the door, and then watch yourself and watch your loved ones for symptoms.
There was one report, doctor, that experts believe nearly 1 in 3 infected patients are actually testing negative, even though they're infected. And so we wanted to ask you, is there a question about the accuracy of the tests, or does that have to do with the timing of when they were tested? Why is that happening?
So there are a variety of different tests out on the market now. And because this came on us so fast, there wasn't the usual process of being able to test the characteristics of how accurate these testing products are. And so some of this is a function of when people were tested. Some of it is a function of how new these tests are. And we're basically trying to do the best we can with limited information.
Yeah, it's important information. Thank you, Dr. Venkat, for providing all of that. And it's evolving and changing so fast.
It really is. So we really appreciate you being here with us
Yeah.
each week to answer our questions. It makes a big difference. And we thank you and what every other healthcare professional is doing right now for all of us.
Doing a wonderful job to keep us safe. Thank you.
All right, well, remember to keep watching our Eye on Health series right here on PTL. This Wednesday, we're going to be talking about COVID-19 again and pregnancy and delivery. It's a big concern for expecting couples these days. That's coming up in Wednesday's Eye on Health, which is brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.